there are a lot more headlines in the news these days about concussions. And it's great that the science is coming forward and seeing what effects these concussions are really having on people, so they take them more seriously. So physical therapists are starting to see more people that have suffered concussions. And when someone comes in with that, we're looking at first the neurological system, making sure that there's nothing that seems off, that everything's working properly in terms of there's no red flags where we need to send them back to the doctor. After we've been able to rule those out, we're going to be looking at the vestibular system, we're going to be looking at the cervical, neck, and also the cranium. When someone has an injury like that, there can be things that are out of place in the upper cervical spine, which can actually lead to more headaches. So we want to clear out the upper cervical spine, that C1, C2, make sure that the alignment's there, and that you have strength to hold your neck in that proper position. And we're going to be looking at the cranium, so those suture lines where the bones meet together. If there's especially been a hit to your head, there can be some compression and loss of mobility in that area, and we need that mobility. So we'll be getting right on those suture lines and mobilizing those joint lines to make sure that there is efficient movement so that the cerebral spinal fluid underneath there can flow evenly. Finally, we might be looking at the vestibular system. So a lot of times after a blow to the head, a person has a hard time with eye tracking and balance. So with this, we'll have some techniques that we do in the office, but then also too, we'll send you home with some home exercise programs to be able to work on the vestibular system and reincorporate it. Physical therapy is really becoming a big part of the treatment of concussions these days.